Hey guys, happy Valentine's Day. Few more questions from yesterday. One of them is if I use Lovenox for my BBL cases. Lovenox is a blood thinner used for DVT or deep vein thrombosis prevention. The answer is I don't. Reason for it increases risk of bleeding. So I do put a max BMI. That's the main reason to decrease risk of DVT. And the most important DVT prevention is early ambulation. So that's why I ask you to start walking even the day of surgery, every hour for 10 minutes. And that's for 2 weeks. Okay. The other thing that it can be added is a sequential compression device that is battery operated. You can take home. It's called a VenaPro or Circle8. And that also decreases risk of DVT. So if you want to be extra careful, I do include it in all my tummy tucks, but BBLs is optional. Okay, so let's start. So can I just do implants or do I need a breast lift? That's going to depend on the position of your nipple and areola complex and compare to the fold below your breast or the inframammary fold. If the nipple position is at the level or below the inframammary fold when you're standing on a side view, then we'll need to do a breast lift to lift that nipple position and reshape the breast. Because if not, the implant is going to either be too high for the nipple and the nipple is going to look like it's pointing down, or the implant is going to drop and you're not going to have any cleavage and the breasts are going to look heavier and more lateral. So it all depends on the grade of ptosis, which is nipple compared to the IMF. Gracias. Arm lift or brachioplasty is removing the excess skin in the upper arm. The most important part of this surgery is the position of the scar. So this scar is from elbow to armpit, and we want to put it in the inner part of the arm, but also when you're extending your arm, it's on the lower aspect. So you don't see it very much when you're raising your arm or when the arm is side by side in your body. Post-op scar treatments are very important to try to avoid this scar to become thick and more noticeable. Can you get a BBL if you're prone to keloids? The short answer is yes, but if you're prone to keloids, you're prone to develop keloid scars or thickening of those scars, getting darker in the areas where the scars are. Good thing about BBL is that the incisions are very small, tiny incisions, like less than a centimeter, and are placed in positions where you can easily hide them in a bikini. So even though you may have scars that are thicker, are easily hideable. What are the important things afterwards? One, to be very diligent with your scar treatments. I recommend silicone-based scar products 2 weeks after surgery. And if you start developing a keloid or hypertrophic scar, to treat it early on. I start my Kenalog or steroid injections 4 to 6 weeks out to try to prevent worsening of the scar and improvement of the thickness and the color.